Good morning, everyone.
Good morning.
How are you today?
Fantastic.
Hello, hello, hello.
Yes.
Yes, yes, yes.
Hello.
Very good. I am Associate Professor Dr. Teo Wei. I'm working under University Kuala Lumpur, Royal College of Medicine, Perak, in surgery department already for 7 years. I'm from Myanmar. Formerly, I worked under UNIMAS also. Today, I'm going to demonstrate how we do examination of a breast lump. Okay, here my students are here. Okay, as Lisa, Atika, Faisal, Liana, and Farah. Farah is going to be simulated patient. Okay, you better go and sit there. And our cameraman is Adit. Okay, 6 students of final year MBBS students. So how I am going to do breast lump examination? First of all, when we are going to deal with the patient, we do need to practice 3 6 steps. First 3 steps are assume the patient as your own relative. Approach them humbly down to earth and deal with them as friendly manner with smiling face. Another 3 steps, once you are already with the patient either in the ward or in OPD, first step is observe privacy. That means cover up the screen. Second step is be with the chaperone. Third step is appropriate and adequate exposure and appropriate position. For that breast lump examination, we can keep different positions. By now, we are going to keep. I'm not going to do examination on the human yet, but on the mannequin. Okay? So in true case, we can keep the patient in different positions, like sitting position, standing position, hand behind the head, and then bending down forward, see the level of the nipple. Okay, compare it. If there is cancer on one side with the invasiveness, it will be lying higher than normal side. Okay, at the same time, you look at the axillary lymph node involvement, if it is possible, if it is visible. Another step is to know the fixity to the underlying muscle. You press on the buttock, the patient has to press on the buttock and press. By that time, we will palpate and try to move the lump, whether it is fixed behind to the deeper muscles or not. So that is the way, so different position. Now I'm going to deal with my simulated patient Farah. Okay, come this way a little bit. You all get come around here. Okay, come everyone. Okay, good morning. I am Associate Professor Dr. Teo Wei. I am going to do breast lump examination. Okay, Farah, how old are you?
I'm 20.
Okay, just 20 years old. It's alright. I'm not going to examine upon you yet, but on the mannequin. Now, okay. Now I have introduced myself, Greek already, and she is not married yet, still single, isn't it? Actually, she is my student. Okay, greeting already. So after that, I have to do explanation. Okay, I'm going to do examination of the right breast lump. I was asked to do that, so I'm going to examine, and I have to get the verbal consent. Will you please allow me to do that?
Yes.
Okay, I got the verbal consent already. Next, to do breast lump examination, there may be a little bit uncomfortable, discomfort. So don't worry, I'll be very gentle and do it quickly so that you may not have any problem. Okay, so last step, once I finish everything, I have to thank you. Okay, these are the 6 steps. Okay, now, to examine, actually, we have to start from the normal, uncomplained side first. But here, there are some abnormalities as well. Assuming that left breast is normal already, examined already. So now I'm going to confine to the right breast examination. For that, first step is the inspection, palpation, percussion, auscultation. But we are not going to include percussion and auscultation, just inspection and palpation. So during inspection, well exposed already. So exposure is from the clavicle up to the waistline. Here is mannequin only. And during the inspection, I have to first of all say something about nipple and areola, any abnormality. For this case, we have little bit cracked nipple as well as little bit deformed nipple. But there is no retraction and no deviation. Apart from that, whatever that we can see, better include and exclude all those positive findings, like any eczema formation or any ulceration or any visible swelling and so on, engorged veins and so on. Now, none. And any sign of discharge also, blood stain, whatever. Okay, for the skin over the breast, I'm going to exclude any visible lump, puckering, dimpling, border range, or any engorged veins, any eczematous lesion or ulcerative lesions. Everything excluded already. Nothing is there. Now I am going to do palpation. For that you can apply 3 methods. One is the circular method, all around. Next method is split method, palpate medial half and palpate lateral half. Next method is wedge method. I am going to palpate each and every wedge segments till I examine the whole breast. Here, what do we need to be careful is not to leave behind axillary tail or tail of Spence, better to be included because it's quite commonly. So breast lump, we usually have breast lump at the upper outer quadrant. Those are common location and they are carcinoma breast. For this patient, in the true setting, the patient themselves will tell us, doctor, while I was taking shower, accidentally I could feel a lump here in my upper outer quadrants of the breast, and they will point you as well, so that it's easier. But in true case, in the human, if you palpate, it's softer breast and better to palpate. But here, being mannequin, you will have a little bit problem. Something like farmer tissues, not so good. Anyway, now we have created already. Here is a breast lump. So anyway, I will use this palpation circular method, okay, or split method, whatever. Now I could feel a lump here already. So for this lump, any other places, no more lump. So with that, confined to the lump, I'm going to examine about examination of a lump. That means site, size, shape, surface, consistency, mobility, fixity. If it is cystic, any fluctuation sign on transillumination sign, those are the ones that we have to examine. Now here, regarding the site, okay, this is the breast lump here, lying at the upper outer quadrant. To be more exact, it is lying in between the 10 o'clock position and 11 o'clock position, and about 3 centimeters away from the nipple. So you can draw a picture as well, identify the location already. Okay, size is about 3 centimeters diameter, shape rounded, surface smooth, consistency very hard, and fixed as it is, but not fixed to the superficial skin yet. Later on, I have to examine, ask the patient to keep both hands on the hip and then compress so that pectoral muscles are contracting. By that time, I will try to move whether it is fixed or still not fixed or mobile, something like that. Okay, so lump already examined, and then this smooth, very hard, okay, seems to be fixed. Okay, now my impression is carcinoma breast or carcinoma in the right breast lying at the upper outer quadrant, in between 10 to 11 o'clock position and 3 centimeters away from the nipple. What if we already examined? So during the OSCE or Objective Structured Clinical Exam with the simulated patient and so on. After dealing, the examiner can ask you, okay, what is your impression? What do you think this case could be? Okay, I will answer carcinoma breast or carcinoma right breast. Okay, after that, the examiner can ask you, okay, how will you do axillary lymph nodes examination? Okay, Kaiser, please come over. Now I'm going to show just, okay, practically being on the right side, I will use my right hand as well to elevate it. And now with my left hand, I'm going to palpate. This is the anterior groove or pectoral groove. And then central groove. And then posterior groove or subscapular groove. And deep inside is the apical groove. After that, this is the lateral groove around the arm. These are 5 grooves that I have examined. Accordingly, are there any enlarged lymph nodes and so on? About fixity, how many, and so on, according to the examination of the lung. After that, another step to go for lymph node examination is in between the deltoid muscle and pectoral muscle, there is a deltopectoral groove. You all can feel your own as well. So I have found few cases already in the world. Those are deltopectoral lymph nodes or infraclavicular lymph nodes. After that, you feel for the supraclavicular from behind. Ask the patient to shrug the shoulder. Okay, you palpate for. Okay, how many lymph nodes that you can palpate? After that, go to the deep transverse cervical lymph nodes. These are the steps for the lateral groove of the lymph nodes. For the medial groove, we will go into the internal mammary chain or internal thoracic chain. Those you can't see, you can't feel. Only with a CT scan or MRI you can see. For the lower segment, it will go first to the subphrenic lymph nodes. From there, it will spread towards the ovary if the patient is still during reproductive age. So during the rupture lutein cyst, ovulation time becoming raw area already, the main focus with the embolization, it will trouble transsalamic, transperitoneal, sit on top of the raw area and start growing. That's how we call it Krukemberg tumor. So Krukemberg tumor could be, the primaries are breast and then the carcinoma stomach. Okay, so that's how we examine axillary lymph nodes. Okay, come next, we are going to examine, okay, another 4 organ systems. Come circle around to examine is, okay, now I'm going to show another mannequin as well. So the routine is liver, lung, bone, brain. For liver, I'm going to examine, okay, we have to expose and then palpate for the liver enlargement, starting from right iliac fossa, keeping this radial border of the index finger parallel to the subcausal margin and palpate for the liver enlargement. Next, I have to exclude presence of the ascites. Ascites usually they are, if it is malignant ascites, they are blood stained. So for that, start from the umbilicus and pacus. If it is dull already, ask the patient to move to the other side. Still keep the fingers on top of it and wait for some time till the fluid shifted already. After that, you pacus. If dullness becomes resonant already, there is a free fluid. Maybe acidic fluid, maybe malignant. Next is, if the patient is reproductive age, you feel for the Krukemberg tumor, or you can even do vaginal examination or ultrasound examination, something like that. So after that, now next step is liver, lung. For that, come help me to sit up. Okay, very good. It's very tough. Okay, for that, first one is I have to pacus and see any stony dullness. That is a sign of pleural effusion. There will be blood stain as well. Okay, next I'm going to listen to the lung sounds. Are there any abnormalities? If, for example, any part of the lungs being blocked by the secondary enlarged bit, that may be solidified, so that there may be sound changes in the sound. So I cannot get vesicular breath sound or something like that. You listen. That is for the lungs. Okay, for the bones, there are 6 steps. First one is the vertebral column, we just feel, and then thoracic cage, ribs and so on. Next is the pelvic bones. Okay, next is the humerus bones. Next is the femur bone, and finally scalp bone. Okay, bring out. So 6 areas you observe. Are there any bony swelling or pain or pathological fracture? Okay, you have excluded already. Final one is a liver, lung, bone, brain. For the brain, we can examine if they are very early. Usually, lately only they spread. In the world, until now, within 7 years, I have found out 1 case only having secondaries in the brain. So for that, you can ask from the history. That's mean any increased intracranial pressure. For that, patient may have headache, nausea, vomiting, maybe loss of consciousness or strokes. Something like stroke-like, that's mean consciousness plus convulsion, seizures, and loss of consciousness finally. These are all CNS problems. You can ask from the history as well. Okay, so this is the examination that we all completed. Breast lump itself and all the related axillary lymph node enlargement as well as the other 4 organ system possibility of the metastasis. That's how we have examined. So next is, what is your provisional diagnosis? Carcinoma of the right breast. Okay, I would like to ask you, Diana, if the patient is having cancer of the right breast or left breast, which one may be better for the patient to have it? Right or left?
The right one.
Right one is better because if the patient has left breast cancer, it's near to the heart. Afterwards, if we treat with radiotherapy, chemotherapy, endocarditis, may cause heart problem. Later, patient can have sudden attack of heart attack and can die of it. That's why it is safer to have right breast carcinoma. Okay. Nowadays, we have the cancer breast screening program already set up, maybe about 4 decades in United Kingdom and other first world countries. The government has to spend a lot of money. And for that, once the ladies get to the age of 50 until 75, they have to undergo 3 yearly mammography checkup. Any lesions found out before the lump appearance, we can do stereotactic identification and biopsy. If it is proven already, treat accordingly, like mastectomy, axillary clearance, radiotherapy, chemotherapy, immunotherapy, hormonal therapy, and so on. For that, depending on receptor status, like estrogen receptor, progesterone receptor, ERB2 receptor, or HER2 receptor, accordingly. If ERBR are positive, it's good for the patient. Patient will respond very well to the hormonal therapy. But HER2 or ERB2 receptor positive means not so good. Patient may not respond very well to the chemotherapy. But another step, biological therapy or Herceptin. That drug is very expensive, about 11,000 per dose. Patient has to get 3 weekly cycle for 18 doses, that's mean 1 year. Okay, now another advanced treatment is targeted T-cell therapy. That is the latest, something like immunotherapy. That means the patient's blood must pass through the machine. We call it apheresis. That means the machine is going to take away just the T cells among the white cells. Once they got enough amount already, the blood must come back into the body of the patient and given. So those T cells will send to the laboratory, and then the technicians will treat with, I don't know what chemicals they will be using. So with that, once treated already, the targeted T cells are activated already. By that time, if we transfuse back into the body of the patient, those targeted T cells will go and kill breast cancer cells. That is something like immunotherapy or targeted T-cell therapy. This is the latest trend of treatment. Okay, thank you very much for your kind observation to our examination of the breast lump from University Kuala Lumpur, Royal College of Medicine, Perak. And today is 9th of June 2017, Friday. Okay, thank you very much to all of you.